Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. And today I'm going to be talking about mental health problems and disability. This will be mostly focused on the doctors doing consultative examinations, but patients may find it interesting as well. As usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. And I want to emphasize that these are my own opinions for this talk. My opinions about mental health and psychiatry would likely be considered somewhat heterodox and antiquated. Nevertheless, I believe that there are grave problems with psychiatry and mental health care in the United States today, and some of what I say will reflect those opinions. And they may be offensive to some people, so if you're easily offended, I suggest you skip this talk. Now, in a disability claim, Social Security considers mental health problems and physical health problems, and many people have both. If it's only a mental health problem, then just like with a patient who's claiming disability for a single physical health problem, it has to be severe. However, if the patient is claiming disability for a group of several problems, the mental health problem and the physical problems don't have to be severe. Social Security will add them all up and determine if, in their opinion, in the aggregate, those problems make the patient disabled or not. And that brings me to my first topic, which is, what is a mental illness? I believe that far too many people who are normal are diagnosed as being mentally ill these days. I think mental illness requires that the patient have a problem that causes distress, either to themselves or others, or both, is dysfunctional, causes the distress to persist and or increase, and is persistent. That means that the problem is present for a prolonged period of time. For example, someone whose beloved dog dies and for 2 weeks has crying spells and loses interest in all of their favorite activities, but by the end of about 6 weeks is feeling and acting fairly normally, is not mentally ill. They are normal. However, if the person's dog died and they lost interest in all their favorite activities and had frequent crying spells, and they were still in that same condition 2 years after the dog passing away, then we would say they're mentally ill. Likewise, people's personalities vary. Some people are more extroverted, some people are more cheerful, some people are more introverted, some people are more gloomy. That doesn't mean that they're mentally ill. In some cases, normal people may even hallucinate. Here's an example. On several occasions, I've greatly relieved patients to the point where they were thanking me in tears because their spouse had recently died and they were hallucinating hearing their spouse saying something to them when they were alone in the home. So what happened was, not only did they lose their beloved spouse, they believed they were losing their mind. It is normal to hear your spouse's voice for some time after they've died, even months or a year or more. It is not an indicator of mental illness. Okay, so now that I've talked about what is and what is not mental illness, I'm going to give my classifications of mental illness, which again is antiquated. I divide them into the neuroses, and in the neuroses, the patient feels there is something wrong with them. They feel that other people are pretty normal, but they are not. An example would be somebody suffering from chronic persistent anxiety. Then there are the psychoses, where the patient is out of touch with reality, usually having hallucinations and or delusions. However, I have never met a psychotic patient who was completely out of touch with reality. Psychotic patients usually know that when you're thirsty, drinking water will alleviate the thirst, and not to jump off a high ledge because you'll hurt yourself because gravity exists. In fact, many patients that I've talked to with schizophrenia are aware that they have a mental illness which causes them to hear voices which aren't real. However, they hear the voices. So they're sort of out of touch with reality, but not completely. Patients with schizophrenia tend to feel suffering. They feel bad. If they're not extremely psychotic, they feel that something is wrong with them that other people don't suffer from. Third are the personality disorders. Personality disorders are likely the most genetic of the mental illnesses. They usually manifest in elementary school, often in infancy. In personality disorders, the patient feels that they are fine. There is nothing wrong with them. It's the rest of humanity who have a problem and cause problems for them. They lack insight. Then there are folks with addiction, and I define addiction as continued use despite harm. For example, a young man who goes to a party and drives home drunk and is caught by the police and gets a DUI conviction may or may not be an alcoholic. If he stops drinking and driving and moderates or quits drinking for the rest of his life, he probably wasn't an alcoholic. If, however, he continues to party and drive drunk and get a second DUI conviction, I think everyone would conclude that he has an alcohol addiction problem. And finally, there are the folks with the organic brain syndromes, people who appear mentally ill due to physical illness, either in the central nervous system or generalized illnesses affecting the central nervous system. This is a psychiatrist's worst nightmare, and one of my great triumphs as a third-year medical student was figuring out that a woman who'd been admitted to the psych ward with a diagnosis of psychosis, likely schizophrenia, actually was suffering from neurosyphilis. And because such cases happen, it's a good idea for all seriously mentally ill people to get a good physical exam and medical assessment. So what's a doctor to do in a consultative examination when they get a patient such as this, a person complaining of neck pain, back pain, diabetes, high blood pressure, anxiety, and depression? Well, first of all, what I do is I ask the patient what seems to be the worst problem, what is causing the greatest difficulty working. If the patient indicates that it's mental health concerns, I ask them if they're seeing a therapist or psychiatrist. If they are, I ask them if they've had their records transferred to Social Security. If they have, I stop there. If they're not seeing a therapist or psychiatrist, I ask if they've been scheduled for a Social Security psychological evaluation. Many patients have. If they haven't and they don't know what I'm talking about, I explain how Social Security considers physical and psychological issues, and I explain that I deal with the physical. And I explain what a Social Security consultation is, that it's a meeting with a clinical psychologist who will discuss the patient's mental health concerns and often give them some psychological tests and then prepare a mental health report for Social Security, and that I will do a physical examination. However, for such patients, I almost always include a Social Security mental status evaluation. And Social Security is interested in 4 things. The first is the patient's appearance. Now, keep in mind, I did 27 years of emergency medicine, and when people have emergencies, they come in as they are. They usually don't have time to prepare their appearance. For example, I saw and treated 2 women, brides, who were dressed in their wedding gowns because they'd suffered injuries during their wedding reception. During a Social Security consultative examination, the patient has been notified weeks in advance, and they have time to prepare and dress for the exam. So, are they clean or not? One of the sad things is the location where I do consultative exams. I see a fair number of homeless folks, and they obviously don't have a shower and a washing machine and money to buy new clothes. However, I've never had a homeless person come in filthy. Somehow or other, they manage to get themselves at least half presentable. How is the patient dressed? Are they dressed appropriately for the weather? Are they dressed appropriately for the circumstances? The last day I did Social Security exams, I had 2 patients who were dressed inappropriately for the circumstances. These were both women, one of whom had a personality disorder, the other one who I think had a hysterical neurosis, who were dressed very provocatively and sexually. Not the sort of dress that a normal woman would wear for a medical examination. Now, I understand that fashions and times change and people come from different cultures. I've treated Amish, Mennonite, and Hutterite patients, and what would be considered normal and modest dress for an average American woman would be considered extremely salacious for a Mennonite woman. But again, taking the overall circumstances into consideration, these 2 women were not appropriately dressed, and that was a clue to their mental health problems. Next, Social Security wants to know, do the patients exhibit signs of neurosis? And again, I don't go into detail about the psychological problems, but does the patient seem extremely anxious? Do they cry during the exam and seem depressed? I've had both things happen. In fact, the last day I did exams, I had a patient who looked unhappy and anxious throughout the entire exam, and I put a mention of that in her report. Third, the Social Security wants to know if there are any signs of psychosis. I do from time to time get psychotic patients, usually folks with schizophrenia, and I ask them about hallucinations and delusions, and I'm always astonished about how forthcoming and frank they tend to be. And I've had patients who are hearing voices in the examination room, and I ask them what they're hearing, and I put that down in their report. And finally, Social Security wants to know how the patients relate to the examining doctor and to the medical staff. And this is quite important because it reflects how the patients will relate to people in the workplace, both co-workers, supervisors, and clients. I had one patient recently who I've seen for 2 exams who is extraordinarily disagreeable due to a personality disorder. And I can't imagine anyone hiring them or keeping them as an employee because their modus operandi is to create great unhappiness in other people. And then when the other people get fed up and get angry, to claim that they're a victim and everyone is against them. I would not work in a workplace if I had to work with such a person, and I believe that person is disabled and unemployable due to a severe personality disorder. There can also be a plethora of physical signs of mental illness in a consultative examination. For example, does the patient make eye contact? Do they smile from time to time? Do they cry? Do they appear anxious? Do they wring their hands? Do they display abulia, a lack of motivation? Do they appear intoxicated? I've had patients who I thought were intoxicated for consultative exams. Do they appear to be in alcohol or drug withdrawal? Again, I've seen it. Do they have other physical signs of mental illness? The last day I did exams, I saw a patient with trichotillomania. I saw another patient with neurodermatitis. I've seen multiple patients in Social Security exams with hesitation marks from compulsive wrist carding. Do they have lichen simplex chronica? Do they have physical signs of addiction, such as jaundice, purpura, or palmar erythema in chronic alcoholism, nicotine-stained fingers and an odor of cigarettes in tobacco addiction, or track marks in intravenous drug use? Another thing to keep an eye on is how do you feel in the room with the patient? You will likely feel some anxiety in a room with a patient who's either very anxious or very paranoid. Conversely, you will likely feel rather down in a room with a patient who's very depressed. And finally, something I was taught a long time ago in my medical career is if after spending 5 minutes in a room with the patient you want to run out of the room screaming, they probably have a personality disorder. Finally, I'm going to give my quick 4-minute question screening test for serious mental illness. And I sometimes ask patients who are claiming disability due to mental illness these 4 questions. Number 1, have you ever been admitted to a psychiatric facility? I had one patient who told me that they had bipolar illness, and when I asked them this question, they said over 20 times, and they were in their 40s. Well, imagine trying to hold down a job when every 6 months you're in the psych ward. That would be pretty difficult. Number 2, have they ever attempted suicide? And if they have, I ask them to describe it for me, and I judge how serious was the suicide attempt. Number 3, have they ever been addicted to drugs or alcohol? And number 4, have they ever been arrested? And I'm surprised at how many patients answer yes to the 4th question. And I ask them to tell me the details. Now, somebody who is arrested for dealing marijuana is probably not mentally ill. I'm looking for the type of arrests that would indicate a disorganized personality, such as making a public nuisance or being drunk and disorderly or other signs of addiction or the sort of disordered behavior that psychotic patients exhibit, which often causes them to be arrested. And I'm also alert for evidence of psychopathic behavior because I do see people who are on the psychopathic spectrum doing consultative exams, and often they're malingering. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.